All right, as everyone is joining, welcome. You are currently at the Pediatric Primary Care, Pediatric Acute Care program overviews. This is our virtual open house that we do every year for our specialty areas. I'm going to allow our friends here to introduce themselves. My name is Ashley Chilla. I'm the Associate Director of Admissions, so I oversee recruitment for all of our program areas here at the Emory School of Nursing. And then I'll let my colleague Michael introduce himself.
Hi, my name is Michael Walker, Director of Admissions, Student Services, and Financial Aid. Excited to meet you. So glad you can join us today. And I will actually pass it over to Teresa Motley.
Hi, my name is Teresa Motley. I am a pediatric nurse practitioner and faculty in the acute and primary care programs at Emory University. So I will be kind of covering a little bit more of the acute care side of things.
Thanks, Teresa. And I'm Jeannie Rodriguez. I'm also a faculty member at the School of Nursing. I direct the Pediatric Primary Care Nurse Practitioner program and work a lot with Teresa in that program. So we're really excited that you're here today and excited to get to talk about the two programs that we have to offer.
Wonderful. So how we're going to structure this is for the first half of it, we are going to hand it over to faculty and program director here to speak about our two different pediatric specialties. And then we will open it up to questions from you all. So if you do have questions, let's wait until the program overview is over and you can either ask them in the chat or you can turn on your camera and talk with us here. This meeting is being recorded, so it will go up on our YouTube, and we will be sending it to all registrants so you can go back to reference anything if you need to. And with that, I am going to pass it back over to Jeannie Rodriguez.
Thank you. Okay, let me share my screen. And what I looks like I'm sharing my slide deck. So let me, sometimes when I do a slideshow, I have to change the view. So give me just a second. Okay. Are you seeing the presentation view? Okay, good. All right, we made it through the first part. Okay, well, welcome. We're really glad that you're here today and able to join us. And we're going to be talking about the Pediatric Nurse Practitioner programs at Emory University. I've already introduced myself, and I know Dr. Motley has as well. One other person that you need to know about is Dr. Anne-Marie Brown. Dr. Brown is the director for the Pediatric Acute Care program here at Emory. And unfortunately, she's not able to join us today, but it's for a good reason. Her daughter-in-law is having a baby, and so she is excited about being able to be there for that. And we're excited for her to have that opportunity too. So I asked Dr. Motley to kind of join us today to give us some pediatric acute care aspects. But both of us are pretty regularly involved with both programs. So I feel confident that we'll be able to answer any questions that you have, but certainly we'll refer you to Dr. Brown if we need to do that. All right, so I'm going to have Dr. Motley tell us a little bit about the role of the pediatric acute care nurse practitioner.
Wonderful. Thank you, Dr. Rodriguez. So just to talk kind of through the role, we'll talk about the population setting and potential career options if you do go ahead and want to pursue a career as a pediatric acute care nurse practitioner. So acute care PNPs do care for a variety of pediatric patients for acute and critical conditions. So these range from things that are a sudden illness or sudden traumatic injury, that's patients presenting for one of those, but also to chronic illnesses and acute exacerbations of those illnesses. So patients who have asthma and have had long-term asthma, but present to you for an exacerbation and need some very specialized care. So the kind of the role, the scope of the acute care nurse practitioner is to assess and diagnose diagnose. So we are completing comprehensive assessments. We are reviewing medical histories, performing thorough physical exams to ultimately help aid in your diagnosis, and ordering specific tests, lab test imaging to help with your diagnosis. We treat and we manage. So we are initiating and managing treatment plans for each patient, medications, other interventions based on whatever the diagnosis may be. We also have within our scope of practice is to perform procedures, and that may vary based on where you work, but we also do things like intubation or lumbar punctures, chest tube placements or removals. So procedures are incorporated into the scope of practice for acute care nurse practitioners. And we collaborate with an interdisciplinary team. So we're working alongside pediatricians, alongside pediatric intensivists in the ICU, surgeons, respiratory therapists, a whole wide range of team members to ultimately provide care for these patients. And then another big role of the acute care nurse practitioner is education. So we are constantly educating families, as you might be doing if you're currently a nurse, educating, providing guidance to caregivers and to patients, providing them education on post-discharge, when to follow up, just to ultimately ensure quality care for these patients. As far as the population, we care for pediatric patients ranging from neonates up until about 21 years of age. Sometimes we'll go up a little bit older depending on what they're presenting for. I work in the surgery world, and so I work in the neonatal ICU and see patients from 22 weeks onwards, 22 weeks gestational age. So we see the very tiny ones up to the young adults. So it is a really big population that we see. Once again, things from acute illnesses to traumatic injuries to chronic illnesses, we see the whole range. As far as the setting, we work where there is children who need acute or critical healthcare needs. So there is a wide range of places where you could potentially work as an acute care nurse practitioner. You could work in the ICU, whether the pediatric ICU, the emergency department, specific acute care settings, like a specific unit, like a surgical unit or a cardiac unit. We also have the potential to work in outpatient urgent care facilities and outpatient specialty clinics as well. So in my current role as a surgery nurse practitioner, I work both in the hospital and also in the surgery clinic, so get the inpatient and outpatient side of things. As far as career opportunities, as a master's prepared acute care pediatric nurse practitioner, you have the ability to work clinically in all of the settings that I just outlined. You potentially have the ability to get involved in quality improvement in the hospital setting or outpatient setting, and potentially could move kind of towards the role of teaching or assisting with teaching if that's something that you're interested in. So a lot of different variability, but I would say the majority of master's prepared pediatric acute care nurse practitioners will enter into clinical practice, but there are other options available too.
Thanks, Dr. Motley. I'm going to talk a little bit about the pediatric primary care nurse practitioner, which is what I do. Pretty much all of us on faculty have some sort of faculty practice where we practice clinically somewhere. And just like Dr. Motley mentioned, her work in surgery, I work with a primary care office in the Atlanta area. It's the Good Samaritan Health Center of Atlanta. And I provide pediatric care with them, both in the clinic, and I also go out into the community where patients live, work, and play, and deliver care to them there as well. A lot of people are in situations where it's not very convenient to come in and get care between 9 and 5, Monday through Friday. They have jobs, they have other things that are going on, and maybe don't have the transportation needed to get there. So we really work at our clinic to be able to service the community where they are. So that's part of what we do too. So pediatric primary care is working in the outpatient world. So we work typically in a pediatric office setting. So some people call those doctor's offices. It's kind of the layman's term for it. And obviously it's usually pediatric specific. And we deliver primary care. So every child in the United States should have a primary care provider. So we see everybody. We see kids with sickle cell disease. We see kids with cystic fibrosis. We see kids that are perfectly well and just need routine care. We see them all because that child with cystic fibrosis needs to still get their immunizations. They need to, sometimes they'll have strep throat and they'll need to be treated for that. So while they may see their cystic fibrosis specialist for that specialty care, they still see us as well. And so a large part of what we do with children that are chronically ill or have special healthcare needs is coordinate that care with other specialists, but we are still intimately involved with their care throughout the pediatric lifespan. You can do everything in a pediatric primary care office. You'll see certainly children who are perfectly well and just there for checkups. We'll say rarely are they just completely well. They usually have some other issue that they need to be seen for as well. We see children who are acutely ill. And then, as I've mentioned already, children who are chronically ill too. So you kind of get to see everybody and everything in the primary care setting. So our population, not unsimilar to what Dr. Motley has described for the pediatric acute care. It's the pediatric population, which goes into early adulthood. Oftentimes people will want an age when we stop, and that's difficult to do because we do have children with chronic healthcare needs that oftentimes it's more beneficial for them to stay in the pediatric arena for a little bit longer. So we might see them a little bit longer than we would other children. But typically around 21, 22, 23 is when people start to transition out of pediatric primary care. So it goes up into the adult age range. Our setting, as I've already mentioned, is typically the primary care office setting. However, I have a fair number of graduates who graduate from our program that do practice in specialty settings. So maybe in a neurology office or pulmonology office. There's sometimes a little bit of overlap in the specialty area with pediatric primary care and acute care specialists. We have a lot of students who practice in those settings as well. Lots of career options. I think I've kind of already covered that, but lots of opportunities there for you to be involved in the primary care setting, but in specialty settings as well. We do have some graduates who do end up working in big health systems, doing things like quality improvement work as well. Some of our DNP graduates do go on to teaching in education too. So that certainly is a pathway that would be available for you. So I'm going to talk a little bit about program requirements now. Dr. Motley, do you want to talk about the pediatric acute care program requirements?
Yeah, sure. So you can see that the requirements for the acute care portion or the acute care program are listed on the slide. But obviously, we work mostly, or the majority of our time is in the inpatient setting, working with sick or critically sick children. So it's important that you would have an interest in caring for children in those settings. It is required that you have your PAL certification, which is Pediatric Advanced Life Support. So it is a additional certification that you would need to obtain to be able to go through the program and to be able to do your clinical rotations and everything that the program requires. In addition, it is important that if you're considering the acute care nursing program, the acute care PNP program, that you have 1 full year of acute care nursing experience. And so unfortunately, this is not an option for those who are just finishing their nursing degree and wanting to go straight into the acute care side. We can kind of talk about if you are interested in doing it more on a part-time basis to get your acute care nursing experience while you work towards getting that experience and doing some of kind of the core courses. But it is really important to have that nursing experience if you're thinking about going into the acute care program. And as of right now, our pediatric acute care PNP program is only offered as a master's degree. So you would graduate with your master's of science in nursing.
Thanks, Dr. Motley. So for pediatric primary care, again, really want you to have an interest in working with children. So that's going to be a lot of what you do. So we want you really passionate about that. We do like for you to have the PAL certification. We do not require it upon entry, but we do recommend that you get it at some point in your program if you haven't gotten it already. We just find that, believe it or not, emergencies show up in the pediatric primary care setting. So you do need to have that competency under your belt. We do not require any nursing experience. So the pediatric primary care program is the program that you can go into direct entry. So if you're currently in an undergraduate or pre-licensure program, you can apply and come directly into our program without nursing experience. We love having our what we call pathway students or direct entry students. We also love having students with nursing experience. So we take them either way, and happy to have you. We do offer the pediatric primary care program as both a DNP and an MSN option. So you have the option of picking either for that program. For program delivery, sorry, I'm going to move my box around here of your faces here. For program delivery, both of our programs are delivered online. And we have students that live all over the United States and are enrolled in our programs. So you can do it from the comfort of your home is the good news, and even do clinicals where you are, which I think is really helpful and beneficial. So it is an online program. We do meet synchronously some throughout the semester for seminars, and then a large part of our program is delivered asynchronously. So you work through modules each week or every 2 weeks to get through some of the content. So we are online, but we offer intensives. And intensives are when you come to campus, you come to Emory. Typically, it's twice a semester. So you'll come about midpoint and then come at the end of the semester. We all kind of gather together as a cohort. And during that time, we might have some seminars that are just better in person. We also offer simulation. We usually do that with each intensive. So you're able to kind of practice the skills and content that you've learned in the didactic course when you come to campus in simulation. So lots of opportunity for you to kind of grow as a cohort and learn hands-on on campus as well. We also have kind of things like procedures labs where you get to do cool things like learn how to suture and put in stitches. So that's lots of fun as well. So that is our program delivery. So I think, yeah, skipped a slide there. So our coursework is delivered in a certain format. So we have what are called core courses, whether you're in an MSN or a DNP program. These core courses are courses like pathophysiology or pharmacology, where everyone in the master's program or DNP program is in that course with you. So it's just a competency that everyone needs to have, no matter your specialty. So those are our core courses that we offer. On top of that, we offer specialty-specific courses. So you'll take pediatric-specific courses throughout your time at Emory, which is really wonderful. I know many of you have done a pre-licensure undergraduate program, and you had to suffer through those adult nursing courses. We will never talk about things like, dementia or things like that. We won't use those words. We don't use very rarely things like congestive heart failure, all those adult type words, COPD, emphysema, we don't mention here, right? So we kind of stick with our pediatric specific content, which for most pediatric people who are really excited about that's just the best news in the world, right? They just kind of really get to focus on the area that they want to really learn about. And students constantly tell us that the pediatric courses are their favorite. And of course it is, right? That's what they're passionate about and ready to do. So we offer those courses as well each semester for you. And then we have courses called clinical practicums. Clinical practicums are where your clinical hours are housed. So You may remember in a pre-licensure undergraduate program, you were assigned to a clinical group and you went as a group to a site and you did clinicals together as a group. We do it a little bit differently on the graduate or post-licensure side. On this side of the road, we kind of assign you one-on-one to a preceptor. So you get individualized attention, and the preceptors are usually physicians or other nurse practitioners. And they work with you in their clinic. So you obtain your clinical rotation, your clinical site, and your preceptor. And then you kind of work with them and work their schedule. And you obtain your clinical hours that way. So we have a certain number of hours that you obtain each semester, and as long as you meet those hour requirements, you're usually in good standing. Generally, students really enjoy those clinical rotations. I know in primary care, we like to have at least half of your hours, clinical hours, in a primary care setting. In the other half, you can feel free to do specialty rotations or urgent care rotations. That would be fine. I think on the acute care side, they tend to rotate into different areas, and actually realize that's on the next slide. So before I continue, I will go ahead and advance that to the next slide. Do you want to talk about the pediatric acute care?
Yeah, thank you. So for the MSN in pediatric acute care, that is required that you complete the program with at least 780 clinical hours. And those are divided up over a number of semesters. So it's not like you're doing all hours in one semester. So that is throughout the entire program. And like Dr. Rodriguez said, we do encourage that you rotate through a variety of specialty and inpatient or specialty outpatient settings. We recommend or highly recommend that you find a preceptor or a facility that offers care in the pediatric ICU as well as the emergency department and pediatric emergency department. Those specific areas see anything and everything. And so it's really good exposure to pediatric acute care. So other than really the emergency department and the pediatric ICU, you are able to look for rotations in other subspecialties that you're interested in, whether it be surgery or cardiac world or ENT, but all of them are either inpatient or in a specialty outpatient clinic or a combination of both.
And for pediatric primary care, the MSN program, the hour requirement is the same, 780 clinical hours. If you choose the DNP route, it is 1,140 clinical hours. So you do get some additional clinical hours with that. So I will point out that that's the basement. That's what you're required to get to graduate and sit for your certification exams. You actually can do more hours than that if you're able. So our rotations, as I've already mentioned, are at least half of them need to be in a pediatric primary care setting. I find that really to develop that competency, you need at least half your hours there. In addition, you can do clinical rotations in community-based settings. I have a student right now who is setting up a clinical rotation with a mobile health unit that delivers pediatric care out in the community. So there's lots of cool opportunities to do that. We also have here at Emory a lot of service learning opportunities where you go sometimes outside of the United States. Sometimes it's just to South Georgia to work with migrant farm worker populations. So it's kind of all over. And you have opportunities to work with populations that you would normally have an opportunity to work with. So those are available for potential rotations as well. And then some of our students do select to do subspecialty rotations. Maybe if you have an interest in asthma, a pulmonology rotation might make sense to you. Maybe if you really need to work on your heart sounds and cardiac assessment, maybe a cardiology rotation would be a benefit. So we kind of collaborate together and discuss that and what's going to make most sense for your plan of study and where you're headed. So this last slide is just some contact information for myself and for Dr. Brown. If you want to reach out to us, you feel free to. We're happy to discuss anything else that you'd like to discuss. And I think right now we're going to move over to the question and answer session.
Absolutely. Thank you so much. Yes, so if you do have any questions, we're here to answer them for you either If you have a question about the admission side of it, or if you have a question about the programs themselves, as Michael mentioned, you can use the chat if you'd like to, but we always love to see the faces so we can associate faces with names. So if you have questions, let us know.
I can ask myself questions too. So, because I know the questions I'm usually asked. So one of the questions I think that I'm usually asked is, what's the difference between a DNP graduate and an MSN graduate, which is a really great question. So I'm going to respond, and then maybe Teresa, if you want to add in too, that would be great. So both of a person who graduates with an MSN and a person who graduates with a DNP, both of those can see patients, right, and deliver individualized, personalized patient care. So you will be able to function as a PNP in delivering that care. What the DNP adds to that is kind of courses around population health and around information technology, but also these project courses. So you actually get an opportunity to do a project while in your program, and those projects really vary a lot. But I'll give you an example of what that looks like as a DNP graduate. So let's say you're working in a primary care setting, and you realize that you're seeing an awful lot of children in your primary care setting with special health care needs. And you recognize that maybe your clinic could do better at meeting those complex needs of those patients. So as a DNP student, you will have learned how to go out and look at the literature, see what's already been done, and pull that together. And kind of come up with a really great PICO question that's specific for your setting, and then put together maybe some interventions that might make sense in your clinic. So maybe it's adding tags to the electronic health record that identifies that patient as someone with special healthcare needs. Maybe it's adding some competency to your referral personnel in your clinic so that they can also do care coordination and make sure that that care is well coordinated. Maybe it's adding additional things to your template when you see those patients, so you ensure that those pieces that are so really needed for that population get taken care of as well. Then after you do all of that, you kind of say, what worked and what didn't work, right? What worked well and what really did not, will never do again. And then you kind of can put that together in a publication, maybe in a professional presentation, and go present that to others as a scholarship of work that you've done. And you continue to kind of refine that area of expertise. So that's just an example of what additional work a DNP can do in a clinic setting. Dr. Motley, do you want to add to that?
Yeah, in addition to that evidence-based practice and taking the latest evidence and implementing it and evaluating and assessing for changes, the doctorally prepared nurse practitioner also has the opportunities or abilities, if they're interested, like Dr. Rodriguez mentioned earlier, to move into the world of academia, or to teach at the graduate level or at the pre-licensure level. And there's also courses on healthcare leadership. And so if you're interested in a leadership role, having your doctorate may kind of give you a leg up on some of those leadership opportunities as well.
Right. And I know too, on the inpatient world, like they'll have DNPs that will work in the Office of Nursing Research within maybe a healthcare setting. So one of our colleagues, Stacey Buchanan, does that at Children's Healthcare of Atlanta. She works in that setting as a DNP graduate. So that's a possibility too.
Yeah, and kind of to piggyback off of that, one of my roles at the Children's Hospital here is within the surgical quality department. And so I work on specific surgery-related quality improvement, evidence-based practice initiatives. So if you are interested in making changes and really making sure that practice is evidence-based, then we can talk more about a doctorate.
So we see we have a question from Regan that says, do you all offer advisement to students that are trying to figure out which program they are interested in?
We do. Yeah, you can, and it looks like Michael's mentioning reaching out to him to talk with him about that a little bit more. Sometimes too, we'll talk with students who are prospective students who are trying to figure out, do I want to do acute care? Do I want to do primary care? Or do I want to do F&P? Right. So we don't mind answering emails about that as well. And I've even met with students on Zoom too. But yeah, I mean, we're happy to kind of talk with you further about that if you're trying to figure that out. Happy to answer questions about that here too.
Just another question or point that I wanted to make, that if you do decide to pursue your acute care NP, and then later on decide that you want to broaden your scope and maybe move to primary care PNP or vice versa, we do offer a postmaster's certification in that other specialty. And so that's something that after you graduate with one or the other, you could go back and obtain at a later point in time.
Right, so we have another question asking about what scholarships are available and are they based on financial need or academic performance? And I'm going to let Michael take that.
Okay, awesome. So great question. We do offer partial academic scholarships here at the School of Nursing. And so you won't need to submit a separate application. Your application for admission will also serve as a scholarship application. However, you are required to submit a FAFSA at the time you submit your application. So you want to make sure, fill out that FAFSA, submit it. We are going to look at your grades. We're going to look at the quality institution that you came from. We're going to look at the rigor of the coursework. We're going to look at any internships, clinical experiences, or full-time work experience that you've had. And of course, those wonderful recommendations, as well as your personal statement. So we'll look at all of those pieces. But we do not, I will just be clear, we don't offer full scholarships, but we do offer partial scholarships. There are sometimes I'm sorry, those scholarships are coming from Emory directly. There are times where there are external scholarships, sometimes from government agencies or from private entities that do offer some partial or full scholarship opportunities. When those arise, we actually send that information to our entire student population so that you have an opportunity to apply and compete for those scholarships.
Great. I
Good
know
question.
another question. Go ahead, Michael.
Oh, other thing I will say is that for the Emory scholarships, it's like you have to maintain a certain GPA to maintain that scholarship. Once it's awarded, it's awarded. So I did want to highlight that as well.
I know another question that our office gets often is, what are you looking for in an applicant?
Okay. So I thought you were going to answer the question.
I'm going to let you take that one.
All right, good idea. So yeah, I mean, I think Michael already alluded to that. We really take a comprehensive look at the individual. So it's not one thing, right? I'm not looking for a GPA. It would be great if you had good grades, right? That will be helpful. But I think we also look at your letters of recommendation. We look at your personal statement. We want to know that and we said this earlier, that you're interested in children. Make sure your personal statement says children several times, right? So we want to see that. And I love it when students talk about how, caring for maybe their grandparents led them into nursing, and that's good. But now I want to hear why pediatric nursing, right? Why do you want to be a pediatric nurse practitioner? So make sure that that's really clear. As far as a DNP, if you want to go that route, you don't have to have everything figured out, right? Don't feel like, oh, I have to know exactly what my project is going to be and what I'm going to specialize in and what I'm going to do. You don't really have to have that all figured out. But if you can give us a sense of, I really like working with adolescents, that might be enough, right? And talk a little bit about your passion around adolescence will help you figure out kind of what pathway you want to take. And oftentimes people who come in with a defined idea end up changing it quite a bit once they get started. So that's okay. We do expect that. But if you can give us a sense of kind of where you're going, that's really helpful too. So lots of emphasis on children, being passionate about children, and just kind of having a good, comprehensive type of an application is really helpful. Think about your references too, and who you send. You do want to not only ask people to be a reference, but make sure they're going to be a good reference for you. Also, I don't know, Michael and Ashley, you might can comment on this too, but it's helpful for me if all your references aren't the same type of references. So they're not all your professors from your undergraduate program, are all your clinic managers, current clinic managers, but there's a little bit of variety so they can kind of speak to different things about you.
Yep, I would agree with that in the same way that you're saying that we think about the students as a whole. With your application, we also want to know what you're like as a colleague, what you're like as a student. All of those things sort of help fill out the picture of who you are as a person.
Yeah, and I'll add too that when you're selecting your recommenders, I, you know, sometimes I see students make the mistake where they pick people who have the most impressive titles, but as a person reading those recommendations, they fall flat because it becomes clear that that impressive person doesn't know you. They've never worked with you closely. They don't know what your motivations are. And so they're not able to give that really useful third-party information and insight into who you are as a candidate. And so you want to select someone who you've worked closely with, they know you, with their eyes closed, they can give a glowing recommendation about who you are, because we want them to paint a picture of what you were like in the workplace and give us some insights into who you're going to be in the classroom. So, pick those individuals very wisely.
And I would say too, if, maybe in your pre-licensure program, you maybe struggled a little bit in the beginning and you didn't have perfect grades, that's okay. Maybe consider discussing that. What did you learn from that experience in your personal statement? So, maybe I had trouble when I first started nursing school, but what I learned a lot about my learning style. I learned about, how to do things, how to reach out to my professors. And you can see my track record shows that I really improved my GPA over time. And that's really actually pretty compelling when you can speak to things like that. I think that's helpful too. So don't worry if you're like, oh, I didn't make straight A's. We accept lots of students who do not have a 4.0, right? That's not necessarily what we're looking for. We'd love you to have great grades, but it's okay if you don't. We really, again, want to take a more comprehensive approach.
All right. I think this question is more for primary care, since acute care requires that you have experience. But the question is, do you recommend coming into the program with some experience to be considered a stronger candidate for acceptance into the program?
We don't have that as a requirement. I think it's fine if you have it. It's fine if you don't. I would say we probably right now about half of our students don't have nursing experience, and they're fine. I will say I can tell a little bit in the beginning, but by the time they finish the program, I don't really remember if they had experience or not. They end up kind of in the same place for the most part. So I really haven't found that it makes that big of a difference. And so if you have experience and maybe you have great experience, as a nurse in a pediatric setting, sure, I would talk about that, but that's not going to be a deal breaker if you don't have that for me.
Excellent questions. Are there any more questions that we can answer for you all while we're all together?
Hi, I did have a quick question because I feel like I've just been hearing a lot of people saying that like starting in 2025 to be a nurse practitioner, you would have to have a DNP instead of an MSN. I was wondering if that conversation also existed at Emory and if you guys like have any expectations that the MSN will be gone in the future.
Yeah, it's a great question. So as faculty, we ask that question too when we go to national conferences. So there is a movement to move nurse practitioner education to the DNP. So you need to be honest about that. I don't think that's happening tomorrow. I don't even think that's going to happen within the next 5 years, if I'm being honest. There's just, at this point, we kind of all have to move together. And by all, I mean universities, certification boards, employers. We all have to kind of make that move together, and everyone's not there yet, especially our certification boards. They still say that the majority of their applicants who apply to them to take your certification exam to be a PNP are at the MSN level, and they don't want to cut those people off. That's just not smart for them. So currently, you can do an MSN or a DNP option to be a pediatric nurse practitioner. That's the same for other specialties as well. But there is kind of this conversation out there that eventually will move to a DNP. I just don't see that in the immediate future. What that would mean for you if you decided to do a master's right now, so you could, and it is a shorter program, you can get out into clinical practice a little bit sooner. If they decided, nationally, everyone said, okay, now you all have to have a DNP. What typically happens in those cases is your employer and your state will give you some time to go back and get that DNP. That's usually what happens in those situations. So, but there's not movement towards that yet. There's just talk.
All right. Any other questions that we can answer for you all?
Yeah, I was going to say, Dr. Motley or Dr. Rodriguez, a question that we often get is, for a further explanation on the intensive experience. And so, which semesters are students coming to campus? Man, how many days do they come,
Yeah.
for each of their visits? And kind of like, should they plan on a 4-hour day, an 8-hour day? What would that look like?
Yeah, it's funny because Dr. Motley and I, before this meeting, we were in another meeting, we were planning intensives. So it takes up a lot of what we do. So intensives, it depends. So for the MSN students, you do start intensives your very first semester. And typically you're here in that first semester for a full week because we combine the health assessment intensive dates with your pediatric specialty intensive dates. And so we just have you here for the week, about midpoint in the semester. And then towards the end of the semester, you come back in again for a week. They're usually 8-hour days. And it's things like in that semester, we're doing some procedures labs. We're doing some practice simulations where you just get to kind of practice. What does it feel like to, do a well visit on an infant, right? What does that feel like? What are the things that you do? And we give you a template that you follow. So you kind of get used to those types of things. You get to practice with your lab partner on listening to hearts and have your instructor there hands-on. So those are the things that we do during intensives. And then in subsequent semesters, because you only have one course that has intensives in it, it's typically going to be about 2 to 3 days each time you come. We might throw in some seminars in there as well in later semesters. For the DNP cohort, if you're full-time, you don't start intensives until your second semester. Your first semester is a lot of core courses. So it's your second full-time semester that you start intensives. And that's typically 2 to 3 days. And it's again about midpoint in the semester, and then you come back again at the end of the semester. They're actually a lot of fun. Students really enjoy intensives. I think there's a little bit of stress there with simulation too, but they really learn a lot, and people talk about how it really pulls it together nicely for them, as opposed to just hearing a lecture and expecting you to go out and do it. That's just not realistic. And it's not how we can teach anymore, right? We really need to have that hands-on piece. And we do that. We have a beautiful simulation lab that's just amazing. And it's actually in a whole separate building, needed its own building for us. And we have that privilege of kind of getting to go there and practice together. Do you want to add anything, Dr. Motley?
I don't think so. I think you covered everything.
Yeah.
Yeah, the acute care intensives are run very similarly. I will say there are some semesters where we might only have one intensive per semester, but early on in the program, you should plan on coming twice a semester for the intensives.
I just dropped in the chat a YouTube link to a little video about the Emory Nursing Learning Center. That is our simulation center. So you can see what that looks like because it is a very impressive space that was recently renovated. And I think it's going to continue to be renovated the more floors that we get in that particular building. So we do have a question here saying, do you have any recommendations for job shadowing? I've reached out to several practices and nurses to shadow, but either I don't get a response back or they say they don't have a shadowing program.
Yeah, so it used to be a long time ago, that was something that a lot of people did is they decided, hey, I want to become a nurse practitioner, and they would contact somebody in their community that was a nurse practitioner and they'd be able to shadow them. I'd say that those opportunities are not as common anymore. And I think a lot of that has to do with federal regulation around HIPAA. Their patients deserve their privacy, and having somebody just come in who doesn't work there, who really isn't doing the business of that practice, and watching you while you're working with the patient, it can be a bit of a violation. And so you tend to see practices steer away from that. You may have a little bit more luck with maybe private practices out in the community. I would think you would have less luck with hospital-based system practices. I think that's going to be harder, but even the private practices now kind of shy away from it. There's just too much of a liability issue and concerns about HIPAA violations as well. So probably one of the best ways to just find out about the NP role is talking to people like us who work as NPs, or other people in the communities. Finding out what they do is helpful. I will say too, and this is something I just want to say because it's a bit of a shock to our students, I think the first semester, is that there is a pretty big transition from being a nurse to being a nurse practitioner. It is a very different role. I mean, there is some things that extend, but it's a different way of thinking. And so I like for people to kind of know that up front. There are certainly some things that you will pull from your, nursing experience and nursing education into this role, but it is quite different. So you should kind of know that up front. It's not completely starting over, but it does take a while to kind of change that mindset and that way of thinking. Did you want to add something, Dr. Molly?
No, not to that. Just one other thing that I get questions about that you might also be wondering is if it's possible to work while you're going through the program. And the answer is yes. We understand that you have personal lives and you need to pay bills and rent and have families to support. And so, yes, it is possible. Depending on, if you're working full time, we might recommend going part-time in the program or vice versa. But it is not something where you need to quit your job to be able to come to this program.
I will add to that our program is pretty rigorous. And I find that people who are full-time and full-time, it's really a challenge. Going to school full-time is like having a full-time job. It's at least that much work. So I don't know many people that can hold down 2 full-time jobs and have a life, right? So it is a challenge. It is a pretty rigorous program. I think a better option is what Dr. Motley was presenting, kind of a part-time or part-time full-time tends to work better.
So I just put in the chat a link to connect with some of our current students who are advanced practice ambassadors. So obviously they're not going to know what it's like to be out in the workforce completely, but they're going to have they're going to be able to let you know what it's like to be in the setting at least. They can also answer questions about curriculum load, whether part-time or full-time, depending on what they are and their experience. So I'd highly suggest going to that link and connecting with some of our current student ambassadors who are post-licensure.
Yeah, they'll have a lot of great advice too, like how to survive patho, right? So they'll have a lot of good good advice for you as well on some of those practical things.
We probably have enough time for one or two more questions if anybody has any. If you don't, that's okay too. Again, this meeting is being recorded. The session is recorded, so I'm going to upload this into YouTube and then send you all the links so you can refer back to it. You also can reach out to any of us if you have questions, either on the admission side or the program curriculum side. I'd be more than happy to connect with any of you. Thank you so much for everybody being here today, for Dr. Motley, Dr. Rodriguez. I learned a lot myself, even in this, so great information. Michael, do you have anything you want to add to it?
Oh, just thank you so much for joining us today. We're serious when we say reach out if you have any questions, and we absolutely look forward to receiving your applications.
Yeah.
Yes.
Don't be shy too. I get emails pretty frequently from prospective students. It's not a problem. Dr. Brown does as well. So, feel free to reach out to us too with any questions that you have. We're happy to help. Glad you were here today.
Yes, and we do have an application deadline coming up. So December 1st is a big application deadline you'll want to keep in mind if you are interested in the fall 25 academic year. So definitely get your questions answered before that point. And we look forward to connecting with you all soon. Thanks so much.
Thank you all.
Thanks, everybody.